I'm Emily Beauregard. Thank you all for joining us today. I'm the Executive Director of Kentucky Voices for Health, and I'm here today with members of the Kentucky Medicaid Defense Coalition. We're having this press call because just yesterday, the Senate voted to pass their version of the One Big Beautiful Bill Act, and House members are convening today for what could be a vote for final passage or more negotiations. But as it stands, the Senate bill has gotten inexplicably worse for Kentuckians, adding massive cuts to Medicaid reimbursements for providers. And that's on top of the excessive paperwork and red tape that was in the House version. The combined impact would be brutal for Kentucky. More than 250,000 Kentuckians could become uninsured. 35 rural hospitals are at risk of closure. 20,000 jobs are on the line. And every single Kentuckian will pay the cost in reduced access to care, poorer health outcomes, and higher premiums. Kentucky is in the crosshairs of the One Big Beautiful Bill Act. We stand to lose more than almost any other state, and the consequences are hard to comprehend. It doesn't just make the largest cuts ever to essential programs like Medicaid and SNAP. It dismantles decades of bipartisan progress on access to care, substance use recovery, and poverty reduction. Rural families, seniors, children, people with disabilities, and people in recovery will really bear the brunt. At a time when basic health care and the cost of living are already far too expensive, this bill punishes Kentucky families who are just trying to make ends meet. Nobody is living off their Medicaid health coverage, but many people are living because of it. This all begs the question, why aren't our elected legislators working on solutions for Kentuckians? This is essentially ACA repeal with no attempt at replace. Any tax benefit the average person gets will pale in comparison to the medical debt and the loss of health care everyday Kentuckians experience. But it's not too late for Congress to change course. Our representatives will have another chance to vote on the One Big Beautiful Bill, and we need them to vote no to protect Kentucky's health and our economy. Now, I'm going to pass it to Dustin to speak a little bit about the economic impact, and then we'll have a couple of other speakers following him.
Hey, good morning, everyone. My name is Dustin Pugel. I'm Policy Director at the Kentucky Center for Economic Policy. So as Emily said, the U.S. Senate on Tuesday passed a massive budget and tax bill that will strip health care and food assistance away from millions of Americans and hundreds of thousands of Kentuckians right here at home, while at the same time ensuring the wealthiest households benefit from a bounty of new tax cuts. 1 in 3 Kentuckians are able to see a doctor or take needed medicine through Medicaid and Connect. That includes children, seniors, low-wage workers, and people with disabilities. Medicaid and Connect coverage are essential to better health and are especially necessary in a time of rising household costs and historic outbreaks of infectious diseases. But they also inject tens of billions of dollars into Kentucky's economy each year. That creates jobs and supports entire local economies. But the Senate bill makes harmful cuts to both of these programs, ensuring that doctor visits and medicine will be more difficult to afford for far too many, while also threatening the very existence of many rural hospitals. While national cuts to Medicaid reach nearly $1 trillion over the next decade, Kentucky's share of that cut would be over $38 billion. Those cuts would be felt across the Commonwealth. An estimated 210,000 Kentuckians would lose health coverage and become uninsured through cuts to Medicaid. In addition to that, 47,000 Kentuckians would lose coverage from Connect and become uninsured due to the failure to extend the enhanced subsidies there. Rural Kentucky stands to lose the most from this bill. In fact, it stands to lose more than any other state in the country. The attack on Medicaid would result in an estimated $10 billion cut to rural health care in Kentucky and lead to 133,000 rural Kentuckians becoming uninsured, which is nearly double the loss that any other state would experience in rural parts. In places like Hal Rogers' 5th District, nearly $1 in $7 worth of goods and services produced and sold originate with Medicaid payments to providers located there. Cuts of this magnitude would ripple throughout all of Eastern Kentucky, leading to layoffs, closures, and even more economic hardship than they've experienced over the last century. Instead of vital programs like these, huge additional tax cuts to the wealthy are the priority in this bill. In Kentucky, the wealthiest 1% would get $45,960 a year on average in tax cuts, while the lowest income Kentuckians may actually see their tax bills increase. The already rich, whose incomes are soaring, should hardly be the priority at a time when many Kentuckians are struggling. Just to give you an idea of how big these tax cuts for the wealthy are so large that despite these unprecedented cuts to popular programs, Congress would still increase the US debt by $3.4 trillion over 10 years. As Kentucky's US House delegation prepares to consider the Senate version of this bill, we urge our members to prioritize the vast majority of Kentuckians and oppose cuts to these vital healthcare programs that are crucial to Kentuckians' health and well-being and critical for our entire state's economy.
Thanks, Dustin. I'm going to pass it to Sarah Carter next.
Good morning. My name is Sarah Carter. So I'm going to kind of tell you about not only my personal experience with Medicaid, but also how through my professional. So I am a single mother. I became a single mother when my son was about 1.5 years old. At the time, we lived in Tennessee, and this was before Medicaid expansion and ACA. I was a working full-time college student when I became pregnant and was in an abusive relationship. And so once I gave birth to my son, I was no longer covered by my mother's insurance and did not qualify for Medicaid at that time because it only covered children and those with disabilities in Tennessee. I'll never forget when he was about 1 year old, I came down with strep and couldn't get in to see a doctor anywhere. Thankfully, Walgreens had started opening mini clinics in their pharmacies at that time, and the provider took pity on me and saw me free of charge. I was running 104 temp and was in pretty bad shape. Luckily, my son was covered by Medicaid, and he was also sick a lot when he was an infant and toddler. During that time, we received SNAP benefits and WIC. Without these programs, I'm not sure we would have made it. I was able to graduate from college with my bachelor's degree in animal science. 1 year later, my son and I, with the help of my mother, moved to Colorado so I could continue my education. Thankfully, at that time, Colorado provided Medicaid for both of us. We also continued to utilize SNAP benefits. A few years later, I graduated again with an associate's degree in veterinary technology and began working as a certified veterinary technician. Sadly, even working full-time in that career field and working a second part-time job, I still did not make enough to afford insurance coverage through my employer. So we continued to benefit from Medicaid and SNAP. My son's father never paid the court-ordered child support and eventually lost visitation. A few years into working as a vet tech, I realized I would never be able to support us on my own. So I began taking the prerequisites for nursing school. During that time, me, my son, and my mother moved to Kentucky to help provide care to my grandmother, who was in the advanced stages of Alzheimer's and required around-the-clock care. Thanks to Kentucky participating in the Medicaid expansion, my son and I continue to receive much-needed insurance and care. One thing I've not mentioned is I have multiple chronic illnesses. I have suffered from chronic migraines since I developed preeclampsia at 19 weeks gestation with my son. I was told by my OB at 20 weeks, my son, who is now 17, would likely not survive. We made it to 38 weeks, but I continued to suffer from frequent migraines that requires ongoing care from a neurologist. I was diagnosed in 2014 with Crohn's disease, and that's while we lived in Colorado. But it had experienced the symptoms since I was in middle school. Medicaid is incredibly important as it has played a huge role in our lives in getting the care that we needed. After moving to Kentucky and taking a sociology class at West Kentucky Community and Technical College and working as a CNA in a local hospital, I realized becoming a nurse was not for me. So I pivoted. I enrolled in the social work program at Murray State University. During my time there, I knew I had found my passion. Social work clicked for me. I attended full time, all while being a single mom and working part-time. We continued to receive Medicaid benefits during this time. During the last semester, which was our practicum, I completed my internship with family preservation and was offered a job 2 weeks into my internship with community collaboration for children, which I accepted. This time was invaluable, even though I realized working with children and families in this capacity was not a good fit for me. I left the community collaboration for children and joined our local hospice organization in spring of 2020, in the height of COVID. That fall, I enrolled in the master's program at the University of Kentucky and obtained my master's degree. I continued to work for hospice, but later transitioned to part-time and began working full-time in oncology so I could obtain my LCSW. Without the help of Medicaid, SNAP benefits, and the WIC program, our journey would likely have been impossible. I would not be where I am today without them. So to talk about today, I am a clinical oncology social worker and counselor in Western Kentucky. Often, our cancer patients find they're unable to work due to the impact of a cancer diagnosis, the treatments such as surgery, chemotherapy, and radiation, but also the side effects from these treatments, which can be and are often severe. The majority of these patients also do not qualify for disability. And if they do qualify for disability, say through the compassionate allowances, they still will not be eligible for Medicare for 24 months. Patients cannot wait 24 months for treatment. I also have several patients who did not have enough work credits to even be considered for disability. Others haven't been in their current job long enough to qualify for their employer's long-term or short-term disability, or the size of their employer is small enough the employer doesn't provide insurance. Then are also those who are self-employed and unexpectedly find themselves facing cancer. With these cuts, these patients will be unable to receive the life-saving care they need. Next, the changes to certification and recertification process, the increase in the frequency and the increase in paperwork will also negatively impact cancer patients. They are already being severely impacted by their treatments, many unable to leave their homes due to the severe side effects. The increase in requirements and paperwork will lead to countless patients losing their Medicaid and thus not being able to receive or delaying treatments which their lives depend on. These cuts and changes will lead to patients' deaths, which could have been prevented. There are many other ways these changes to Medicaid will devastatingly impact our patients and community. Thank you.
Thank you for sharing your story, Sarah. I'm going to pass it to Angela Rowe next. And Angela will be our final speaker today, but we do have a number of other speakers who wanted to be with us today and for one reason or another could not. So we're happy to put you in touch with others as well as with Sarah and Angela following this call.
Hello, can you hear me?
Yes.
Okay, just a shout out to Sarah. My story is very similar in having participated in SNAP and WIC and been a domestic violence survivor and being able to get several degrees, all because of these social support programs. So good afternoon. My name is Angela Rowe, and I am a mother, a grandmother, a lifelong Kentuckian, and a woman living with cerebral palsy. I've spent my career working in education, mental health, housing, and organizing for change. But today I speak as someone whose family and future have been shaped by Medicaid. Not once, not twice, but over and over again. Like so many others across our state, my family has relied on Medicaid, not as a handout, but as a life saving support system. It's helped my children and I through crises, ensured that my grandchild could see a doctor when she is sick, and made it possible for us to live fuller, healthier lives. Medicaid has also made it possible for my children to get critical care. My daughter was diagnosed with papilledema, a dangerous swelling of the optic nerve. Without Medicaid, we couldn't have afforded the specialist she needed. My youngest son just recently had to have his wisdom teeth removed, and that care was only possible because of Medicaid. And when my oldest son suffered a serious injury when he fell from a barn and fractured his back, Medicaid covered the emergency care that otherwise would not have been accessible to me as a single mother. For people like me living with disability, Medicaid is survival. It has helped me access care that private insurance doesn't cover. Things like physical therapy, mobility evaluations, and ongoing treatment to stay healthy and active. Medicaid helped cover my care when I was pregnant and gave me access to maternal health care I otherwise would not have been able to afford. It helped ensure safe deliveries and postpartum care. And later, when my daughter became a young mother herself, Medicaid was there for her too. We know that Kentucky has one of the highest maternal mortality rates in the country, especially among low income and rural women. Without Medicaid, many women, many mothers would go without prenatal care, labor support, or follow up services. That's not just unacceptable, it's deadly. The proposed federal budget, what they're calling the big beautiful bill, would slash $1 trillion from healthcare. That isn't just a number. That would be the largest cut to Medicaid in our nation's history. For Kentucky, that means impossible choices. Do we close rural hospitals? Do we deny treatment to those in mental health crises? Do we turn away families in need? In Round County alone, which is where I currently live and have lived since 2000, over 5,000 people rely on Medicaid for their health coverage. That's nearly 1 in 3 residents, my neighbors. That includes children, seniors, people with disabilities, and working families who are just trying to make ends meet. It includes me. It includes my family. The bill being debated in Congress, what they're calling the big beautiful bill. Oh, sorry, I repeated that. These changes would also reintroduce harmful work reporting requirements. We know from experience that these bureaucratic hurdles don't lead to more employment, they lead to people losing coverage. In fact, when Kentucky proposed trying this a few years ago, over 95,000 people were projected to lose coverage, many simply because of paperwork barriers. That includes folks who were working but couldn't report fast enough. That means more people ending up in emergency rooms instead of getting preventative care. It means that people do not get care at all because they cannot afford it. It means family, friends, neighbors suffer. Let me be clear. Medicaid cuts don't just impact someone else. They impact us, our kids, our grandkids, our friends, our neighbors. This isn't just a policy, it's personal. These cuts would hit people with disabilities, rural families, and mothers the hardest. It would undermine hospitals like St. Clair here in Round County and force even more people into medical crises and poverty. We cannot stay silent. Healthcare, like housing, like food, is a human right, and those are hills that I will die on. And I would just like to say that I currently do not have Medicaid. I have health insurance through my employer, but I've not been able to get the care that I could get on Medicaid because I cannot afford the copays. So I'm definitely a big supporter of Medicaid, and hopefully one day we'll have universal health care. And I am finished.
Thank you, Angela. You summed that up so well in terms of the personal impact and the impact to the entire community. I really appreciate you joining us today. And I'm going to open up the floor for questions, but do want to say, again, I put it in the chat. We'll be sharing a recording of this video if you'd like to take clips from it. We do have a number of other people. Today was just not everyone's day in terms of internet access, other last minute issues that have come up. We have some providers that are happy to talk with press. We have some additional individuals who are directly impacted, who are happy to talk with the media. So just reach out, and we can also connect you with Angela and Sarah. Now we're happy to take any questions that you have.
So this is Bruce Maples. I have a question. Um, Obviously, there's a lot of people who are upset about this bill. Have you or anybody on the call been able to speak with any of our Congress members? And if so, what have they said?
Well, oh, I saw Dustin just come up off mute. I was waiting to see if someone else wanted to get started with that. Dustin, why don't you go ahead?
Well, I was just going to say, we have, us and other folks within the Medicaid Defense Coalition have had a lot of conversations with staff, and there's not usually a lot of, it's usually a one-way conversation. I'll put it that way. So, I mean, I think they have heard our concerns, to what extent that has broken through. Obviously, I think the vote speaks for itself. So, our hope now is that the Senate version is different enough from the House version, and causes actually much more harm than the House version did, which was pretty bad in its own right. That our congressmen really understand that and see it, and take action accordingly. The ball is in the House of Representatives court now. And so it's going to be really important that they protect their neighbors, their constituents, the businesses that are here, by rejecting any of these cuts to Medicaid, not just the Senate version, but even what was passed out of the House.
Yeah, I don't think I have much to add to that. I think Dustin's assessment of the conversations that we've been able to have with staffers of our members of Congress is that it really is a one-way street. We haven't gotten much information, reassurances sometimes, but the reassurances haven't really panned out. And I haven't heard much different from other advocates or providers or people who would be directly impacted, in terms of what kinds of conversations they've been able to have. Did you want to add something?
Yeah, and I see Melissa's question here. We can get to that as well. But I do want to say, one common refrain that I hear from our members of Congress, is that they want to root out waste, fraud, and abuse. If you look at the kinds of folks who are likely going to lose health insurance because of this bill, if it becomes law, you're talking about primarily working people, low-income working people who are not offered health insurance on their job, but are likely to get tripped up in the paperwork that is going to be required. Sarah and others mentioned work reporting requirements. They're also planning to double the number of times people have to prove their eligibility. And I just want to say, I hope you hear from the folks on this call and from others that the folks who use Medicaid to see a doctor, to get treatment, to take medicine, they don't feel wasteful, fraudulent, or abusive. They're using this because it is an important way of being able to access medical care. And so, my hope is that our congressional delegation sees and hears from the folks who are so much better off because of this coverage, and kind of walks away from this notion that their life-saving healthcare is somehow wasteful or fraudulent or abusive. It is life-saving, and certainly improves the quality of life. So, I just want to at least point that out. Emily, do you want to answer Melissa's question?
Well, I'll
Oh,
add
go ahead.
one thing to what you shared, because I think too often we hear from our legislators that if someone has a disability or an illness, or if you're a caregiver, that you'll be exempt from this requirement, from the additional paperwork, but you have to prove your condition for an exemption, and that requires its own paperwork. And you have to prove it before you're able to enroll or renew your coverage. You don't get a grace period in this bill. And so those are the ways that people end up falling through the cracks. And I fear that a lot of people will fall through the cracks based on the states that have attempted to do this in the past. And even now, Georgia having, a handful, a few thousand Georgians enrolled in a program that was intended for 250,000. And Angela made the good point that now covered by commercial insurance through an employer, it's harder to get the care that she needs because of the copays and the out-of-pocket costs. We see that a lot. So for that to be the goal, that everyone is just able to, find that job that pays them well enough to afford commercial insurance, I don't see that as the reality for most Kentuckians and for what Kentuckians are paid. And so I think our legislators just need to think really clearly about the reality of their constituents' lives and the economy, and focus on solutions that would improve access to care. We haven't heard one solution in this entire debate. And Kelly, did you want to say something more about conversations with our members of Congress before I go to Melissa's question?
I can briefly. My name is Kelly Taub. I'm the Director of Communications and Development with Kentucky Voices for Health. And thank you again for everyone being here. We have reached out numerous times and joined many others with the holiday weekend, especially. Coming ahead, I think it's going to become even more difficult to break through the noise. And everyone knows how switchboards work, whether it's on a local, state, or federal level. Individuals, be it ourselves at KyPolicy or Kentucky Voices for Health, or folks throughout the state like Angela and Sarah who are joining us. It's not the folks at the switchboard that aren't, available to answer that call. They do, but when it's patched through to members of Congress's offices, we find a lot of difficulty actually reaching anyone. So thank you, Bruce, for that question. But to pivot, since we're getting more questions in the chat, Melissa Patrick asks, can you explain what the Senate's version of the bill would do to Kentucky's provider tax and what that would do to Medicaid funding?
Yeah, Melissa, the Kentucky Hospital Association has said that this would be devastating for hospitals, rural hospitals in particular. There was also a report from the University of North Carolina, from researchers at the University of North Carolina, that came out just recently that found about 338 hospitals in the United States at risk of closure with these cuts. And they determined that risk based on 3 years of operating in the red, or having a high percentage of Medicaid patients with Medicaid coverage. And Kentucky has 35 of those hospitals, 1 in 10. Our population makes up 1.3% of the entire population of the United States, and we have 1 in 10 hospitals at risk of closure. And to me, that is, in a strange way, a testament to just how successful Medicaid expansion has been in Kentucky, and just how much our hospitals rely on Medicaid to stay afloat and to keep their doors open. And again, keeping their doors open for everyone in the community, whether you have commercial insurance, Medicare, Medicaid, or happen to be uninsured. And so the provider taxes, that it is essentially a way that providers are able to increase their reimbursement rate by putting up a little bit of money for what would be the state match, but it doesn't have to go, it's not taxpayer dollars in the state budget. Providers are putting up a tax of their own to pull down more federal dollars at our really generous match, which is about 72 cents on the dollar for a traditional population, 80 cents for KCHIP, the Kentucky Children's Health Program, and 90 cents for Medicaid expansion. And that money is used to increase provider reimbursements. That's true for nursing homes, for ambulances, for hospitals, for the support for community living waiver providers. And there may be a few others in there, but those are the primary ones. So with the Senate version, not only does that limit the percentage of provider taxes that we can use to leverage those federal funds, state-directed payments, which is how you kind of get to that higher reimbursement rate, those would also be limited. So right now, hospitals are getting the average commercial rate for their Medicaid services, and that would drop down to Medicare rates. And with that alone, hospitals would be losing billions of dollars.
I'll jump to Mary Levis' question next. She's with WKYT. Can you tell us the most vulnerable demographic when it comes to Medicaid cuts and how it will impact them?
Yeah, let me start by piggybacking off of what Emily said. So these provider taxes are certainly used to improve our state-directed payment programs, which are aimed at increasing the reimbursement rates, but they also existed before our state-directed payment programs, and they were really just aimed at trying to be able to afford additional services. I think supports for community living is a great example of that. SCL providers receive the fourth largest amount of funds by provider type in the state of Kentucky. And that's because the services are very comprehensive and they're very expensive. And so using provider taxes to be able to pull down enough federal money that we can offer those services is really important. We still have wait lists over, I think it's around 15 or 16,000 people now for these types of waivers, others as well. But I think it is important to recognize that when we are less able to afford services like SCL, it makes it more difficult for our General Assembly then to expand the number of slots that are available. So I think that's one example of a vulnerable population. Honestly, a lot of the policies that are in this bill take aim at our very successful Medicaid expansion. When we expanded Medicaid, our uninsured rate dropped by 2/3. And so that's the exact same group of people now that we're trying to, Congress is taking aim at with things like work reporting requirements, additional verifications, co-pays, and so forth. But like Emily said, just because they're the ones that are being sort of taken aim at, which are typically low-income workers, right? That's the typical person on Medicaid expansion. More than half of them are working. If you take out people with disabilities, it's more like 2/3 of them are currently working. There are still others who would get tripped up. People who should be exempt but won't be able to prove it. People with substance use disorders and disabilities and health conditions that mean that they shouldn't have to do this extra verification and extra reporting, but would almost certainly be tripped up in it. A good example of this is that when we unwound the COVID era protections for coverage a few years ago, 15% of Medicaid enrollees lost their benefits, not because they were found ineligible, but because they had what are called procedural errors, late paperwork, typos in their paperwork, paperwork that they were unable to complete entirely because of an address issue or so forth. So, these procedural errors are the same types of errors that I think folks in Congress are banking on in order to reduce the number of people covered by Medicaid. While I think there are certain people that Congress is really trying to terminate coverage for, there's a lot of folks who are going to get caught up in that dragnet.
Yeah, I would agree with that. The next question that we have is from Mary. Can you tell us the most vulnerable demographic when it comes to Medicaid cuts and how it will impact them? Mary, I don't know that we could say with certainty what the most vulnerable population would be, but I think that certainly people with disabilities, seniors, people who probably should be exempt from some of these requirements and yet will have a really hard time with the paperwork will be the ones that are most vulnerable. It's a really difficult process today to complete that paperwork and to complete your renewal. People often end up, just as Dustin was saying, during the Medicaid renewals, 60% of the terminations were related to paperwork. They were administrative, and a lot of those weren't at the fault of the individual. They were something that, had to do with a processing error or a delay or lost paperwork on the side of the cabinet. And while the cabinet I would say, did a pretty good job of trying to fix those problems with being very short-staffed. It was still a problem for a lot of people. There were a lot of people who had to re-enroll. Some people who assumed, well, I lost my coverage, and just truly assumed that meant they were ineligible and did not try again. And had they tried again, they would have been eligible for Medicaid and they would have been re-enrolled, and that coverage would have been backdated. But it's discouraging to people, and people assume that, the state knows best. The state's telling them they're not eligible or that they didn't do something within a time frame, and that's that. And people go uninsured. We see that happening every day now. This would make it much, much worse. And then I think as a population, rural Kentuckians would face the most severe shortages in terms of providers and lack of access. So even if you keep your Medicaid coverage, or if you have commercial insurance, you're going to have fewer providers who are able to care for you. And that in and of itself is going to be an enormous impact, and it will really affect all of us in one way or another.
Yeah, I put a link in the chat to Kaiser Family Foundation's analysis of both funding cuts and coverage losses among rural parts of states. And I really encourage you all to go look at that. I mean, it is remarkable how much worse Kentucky will be hit compared to any other state. And that, usually when we talk about the disproportionate impact to Kentucky, we're talking about, a percentage compared to California or Texas, any other large state. Just in outright funding and outright number of people, Kentucky has about double the amount of losses as any other state. So it is significant. I mean, it is really, really dire looking if these cuts go through. So again, I encourage you all to look at that research. It's very short. There's 2 tables, but please do know that rural Kentucky has the most to lose here.
Hi, this is Sam Harris-Simowitz. I'm with WCPO in Cincinnati in the Northern Kentucky area. If this passes through, how immediate would the state of Kentucky and Kentuckians see that impact? And Emily, you kind of just mentioned it, but if this goes through, what, if any, options will people really have?
Yeah, as far as the impact, while there are different kind of implementation deadlines in the bill, what we know, and I think tariffs has given us a good sort of window into what happens when there's uncertainty. What we know is that the uncertainty will already lead to changes and the need for planning and implementation. So while these work reporting requirements, for instance, wouldn't be in effect until the very end of 2026 or very beginning of 2027, the amount of planning, the system changes that would have to be put in place in advance of that will probably have an impact. People will be getting notices. People will be hearing in the news that these things are changing, which creates a real chilling effect. And providers, if they're anticipating that rates are going to be cut, they will also be having to make those hard choices about whether or not to continue providing services to Medicaid patients, to accepting Medicaid coverage. They may make changes to their reimbursement rates in one way or another, or even how they pay their providers and their workforce. We've heard from a provider working in Lexington, one of the hospitals there, that they have already changed the way that providers are being reimbursed in anticipation of these cuts. So I don't think that we could understate the impact of the uncertainty and just the expectations that people have for cuts. Angela, did you want to add something there?
Yes, I wanted to add something about the impact to the rural Kentuckians, because I was just reflecting back on a time when my neighbor's 16-year-old son had overdosed, and we had to call the ambulance, and it took them 45 minutes to get here. And that's with St. Clair being right here in town. So I couldn't imagine how that situation would have ended up if St. Clair closes down. I mean, we all have our horror stories with St. Clair, but it is, like that's where I had my children. Like this as many horror stories as there are also the stories where it saved lives, like that young man. Like, what would have happened to him if St. Clair wasn't here? And if, then the next county over is Fleming County, which is still, every other county around us is at least a 30 to 45-minute drive. And St. Clair is literally 15 minutes from where I live at. So I think the impact, you just don't realize, for us to get services, to go to Lexington to get like the major specialist service, that's an hour drive. So again, like you're talking about the transportation issues and talking about employment. It's easy to say, oh, like get a job. But like my 16-year-old has applied for several jobs and he's trying to get employed and he's not gotten a call back on any of them. So, in theory, you can say, oh, people can get a job. But when you live in areas where the only employers are the university and the hospital, and one of those is going to shut down and the universities are losing their funding as well, that really impacts the employment that's available. And you touched on the rate of pay. I mean, I, thank goodness, now have a job that pays pretty well. But even with that, I can't afford to go to the doctor because I can't afford the health insurance and I can't afford the co-pays on my employer provided health insurance. So, I mean, it really is going to impact our friends and neighbors and families and children. So I just wanted to, and you touched on the paperwork. That is a major barrier. I personally know and have been there where you lose your services because you thought you turned in all the paperwork, but there was one little paper that they needed that they didn't get. So then you have to start the whole process over again. And that's like a 6-month process to get that going. So just adding those more barriers to it is just going to, make it harder for folks who really need health insurance.
Yeah, thank you, Angela. And at the end of the day, it's inefficient. We are literally spending more on administrative paperwork and red tape to serve fewer people. That's our dollars will be going to that administrative paperwork that is wasteful and not going to the healthcare that is needed. We still have time for more questions. If you have any, you're welcome to come off mute or put your questions in the chat. All right. Well, thank you very much for joining us this morning, for making time for our press call. Like I said, we'll be following up with everyone who's registered. You'll get a link to the recording. We'll also be putting out a press release later today. And if you'd like for us to connect you with anyone, please just let us know. Thanks very much. Have a good day.